Doctors have always kept notes on their patients' care. For generations, that meant those records wound up here, in paper charts with complex filing systems. Those records are now moving here. Electronic medical records, or EMRs, are undeniably a huge part of today's healthcare documentation, and they provide significant benefits. But in order to reap those benefits, the information has to get into the EMR in the first place. As great as EMRs are, the doctor just can't blink the information into it. So how does it get there? Some say the answer is to have the providers key the information into the EMR themselves. They say this will eliminate transcription bills, but they don't add in the high cost of the doctor spending his valuable time typing. Just because the doctor can type for himself doesn't mean it's the best answer. What about voice recognition software? It has made some great advances in recent years, but it still creates too many errors to make it practical for heavy daily use on a broad scale.
Okay, back correction, chest pain.
Add to that the ideal conditions voice recognition needs, such as a quiet room and strict adherence to voice commands, and you can understand why less than 1% of documentation across the country is done this way.
Okay, let's go back again.
It has its place in the process, but a much smaller role than some are trying to make it play. Here's the reality. You adopt an EMR that's supposed to save you time and money, improve patient care, and make billing more efficient. Not long into the process, your providers and staff are stressed, productivity and patient counts are down, your patients are unhappy, and instead of costs going down, they're actually going up. Sound familiar? What's happening? Healthcare technology is trying to keep up with the rapidly changing needs of healthcare providers, but maybe it's trying to take a leap too far, too fast.
At ScribeRight, we understand what you're going through. We know there's an incredible need to cut costs, but not at all costs. The patient's health story is still crucial, and it deserves to be told well. We believe that the best way to capture this story is with a combination of EMR, voice recognition, and human transcription. Narrative dictation is still preferred by most physicians because it's more detailed and much more time efficient. If the goal of eliminating transcription is to save money, it's wise to look at the real cost of doing so. Consider this. It takes an average of 12 minutes for a trained provider to chart one patient visit in an EMR. If she sees 15 patients a day, that means 3 hours of her time. So she either spends less time with her patients or uses up her whole evening finishing her notes. Usually both. She understands the need for quality documentation, but feels she's losing the connection with her patients, which was a key reason she became a doctor in the first place. And she's giving up a lot of off-time hours charting notes. What she needs is practical use along with meaningful use. Let's look at another option. The same doctor could spend 1/4 of that time dictating and e-signing her reports, saving her over 2 hours a day. How many more patients could she see in 2 hours? 3, 4, more? 3 patients at a billing rate of $150 per visit is $450 of lost productivity. $450 per doctor, per day, every day. How many doctors do you have on staff? Imagine hundreds of doctors at a hospital, and you can start to see the enormity of the problem. The cost of using a quality transcription service to produce 15 2-minute reports is less than $60, which begs the basic economic question. Why spend $450 to solve a $60 problem?
So we've really found using a blend of EMR, voice recognition, and human transcription that has made the most sense to us in terms of a long-term strategy. ScribeRight's been our trusted partner as we've moved from tapes to digital to EMR over the years. In fact, we're now on our 3rd EMR, and ScribeRight is still a strong partner with us. Our EMR adoption rate was faster and smoother by using transcription with the EMR. When we were ready to go live, ScribeRight was able to upload 2 years of files, which made a huge difference for our practitioners in terms of having that information available. Huge advantage. We're still using ScribeRight to support us now in conjunction with our EMR, and we continue to expect that relationship to go on as we move toward our 4th EMR.
So if the cost savings are evident and physicians prefer it, why aren't more companies using transcription along with their EMR? In many cases, older transcription technology can't integrate with EMRs. You need a 21st century transcription company to match your 21st century medical records. So what does that look like? Let's take a look at how the ScribeRight platform can benefit you when used together with an EMR, even if you still have paper charts. The doctor dictates, uploads, and goes about his day. After our expert transcriptionists complete the note, the customized delivery system that we set up for you takes over. Need a hard copy for your paper charts? Done. At the same time, digital copies are sent to your EMR, to the referring physician, to your billing department, and a backup copy is saved on your data server, all automatically. Imagine it, this frees up countless staff hours, improves efficiency, and produces the highest quality documents. And you just saved hundreds of dollars.
We needed a transcription company that had the technology to help us transition and to be able to support us long term. We chose ScribeRight because they understand EMRs, they understand transcription, and they also understand the integration between the two. What ScribeRight offers us is the ability to blend our system of EMR, transcription, voice recognition into one process. It also is cost effective for us. Of course, we wanted to be cost effective. And it also allows us to stay within the process that we have set up for our physicians working with the EMR and not having to change as much of their daily flow as possible.
By utilizing ScribeRight together with your EMR and voice recognition, you get a win-win-win result. Give us 30 minutes and we'll show you how this can work for your facility.
Don't let EMR come between you and your patients. ScribeRight's integrated services save you time for what's really important.